right, so let's go deeper into numbers. Karen Gignani is President and CEO of America's Health Insurance Plans. Good morning to you, Karen.
Good morning, Bill.
We read a lot about this stuff. It seems like every day this week a new poll or survey comes out. I don't know what to believe.
I think people want to know what it means for them, and it's hard to sort through that as an individual. So there are 3 points, I think, for people to take away. One, costs. Healthcare premiums follow underlying costs. Costs are going up because providers are charging more, number one. A number of our members are seeing 40, 50, 60% increases. 2, people buying coverage individually in a bad economy have decided for their economic reasons sometimes they can no longer afford it. That means the cost of people in the pool goes up because it's the people who have the highest costs who stay in. And then third, we're adding new benefits starting September 23rd under the legislation, and new benefits follow costs.
So your organization, you're not for this health care reform law? I mean, just based on that answer, I get that impression.
We've had some very strong concerns about the cost of the legislation. We've been very supportive of the concept of bringing everybody into the system. We have to get everybody covered, but the point is how to do that as affordably as possible. Our members are working very, very hard to try to do things as affordably as possible, but for people who have coverage now, many of them are going to see increased coverage requirements, new benefits, new requirements, and that will require additional costs.
Now,
and our members are trying to do this as affordably as possible.
I got you. Now, what you say sounds to me like a contradiction which came out of Medicare yesterday. And that is, it concludes over the next 10 years the impact on cost is moderate. You challenge that.
Well, we do challenge that because we think that there hasn't been enough done to reduce costs. We think more can be done, and we're doing a great deal with providers around the country to try to get our hands around this, but we think more can be done, and we think indeed over time people will recognize that more needs to be done.
Let me get to that point in a moment here, but so you got the Medicare group saying that it will go up, but only slightly over the next 10 years. I think it was like a couple $100 a person they concluded. The White House is going the other way. They say total health care spending would drop more than $1,000 under the new law. Now, who's right there?
Well, the same day this report is out, there's also another report out from Mercer Consulting where employers are saying their cost projections are going to be increasing by 10% next year. Now, if they shift costs to individuals, then that will go down to about 5.9. So we see a number of different interpretations about what's on the horizon based on what are underlying costs. So if you have an underlying cost problem that we haven't gotten our hands around, number one, and you add new benefits, that's going to require new costs. And what people have now, if they have policies that don't cover first dollar prevention, if they have policies that don't have, have annual limits, and in the future that we will not have annual limits, that's just basic economics. So we have to get our hands around how to do this as affordably as possible. Yeah, and that's what we're working hard to do.
The basic economics tell me if your bill goes up, then the law that said it was going to bend the spending curve was not right. And if your bill goes down, the White House is right.
Well, and I think if you're adding benefits, you're going to increase costs, and what we need to do, all stakeholders need to work together to try to do that in the most affordable way.
Right, Karen,
that's what the issue was last year. It's the same issue today.
Rasmussen says 56% favor repealing health care. You live and work in Washington. I think people are worried about the costs. Is that possible?
I think, Bill, people are worried about the costs. We can do more in terms of cost containment. We need to do that. Members of Congress need to confront that, and we're doing our part, and we're going to continue to do our part to try to do things as affordably as possible.
Karen, thank you. I'm out of time. It's a big issue, and it's not going to go away. In fact, tune in tomorrow, because we'll probably find a new survey out there or a new study that tells us something else.
Indeed.
Karen, thank you from Washington.
Thank you.